got to be the township, I would think.
That's a township road, yeah. There's still a few of those. That's
Maybe the GPA could pave it. Maybe the GPA could.
See?
I'll check if there's a bridge.
Can we call this meeting to order, please? Do we have any courtesy of the floor? Okay. Update on Gracedale. Mr. Soto?
Okay. Just going to go ahead and give you a brief summary of what's going on with Gracedale. We do have an increase in our agency costs with regards to our RNs, LPNs, and CNAs, related to staffing, which we are definitely working on. We are aggressively working on to go ahead and get more people to work for Gracedale. And we had another little issue. If we look towards the end and the CMS star rating, it did go down from a 4 to a 3 in staffing, which has caused us to become an overall 2, because when the staffing goes down 1 star, it affects the overall rating for either staffing or health inspection. But of course, health inspection is frozen until November. So that did affect our star rating, but like I said, when we get our staffing back up, our star rating can also go back up as well and bring us back up 2 or 3 stars. The good news about it is though, if we look at our quality measures, where we were always a 1 star and then went up to a 2 star, we are now at a 3 star for quality measures. And that's something that we've been working on for a long time in terms of our goals.
Ms. Hefner,
Yes, sir.
can I interrupt him for 1 second?
Yes, you can.
Sure.
So how is that? How long is that evaluated? Quarterly, monthly, annually? The star rating?
Oh, the star rating is every quarter.
Quarter. Okay,
Yeah,
thank you.
every quarter. And so we're doing that. Also, I wanted to bring your attention with regards to quality measures to looking at our pressure ulcers. We now have 4 columns as opposed to 2 columns. What we were doing before when we were giving you pressure ulcers is we were letting you know what the pressure ulcers were and also the number of facility acquired, instead of telling you how many pressure ulcers were healed and what's left over, and also what came from the facility and the number of residents involved. So we'll be breaking it down. But when you look at it and you look at the pressure ulcers that were actually treated and healed, you'll see the numbers are a lot lower, especially with regards to total facility. Our goal benchmark should be 13, and we're at 55. And we continue to get those pressure ulcers down through the techniques that we're using to work with wound management. We've also addressed the issues with the mattresses as well, and also with the type of treatments that we're using, and our wound care consultant as well. So that's all good things. And that is what I have in total. Are there any questions?
Yeah, how come it says 55 pressure ulcers total facility, and then the total residence is 54? Why is it why is it 1 off?
It doesn't work. What it does is that 1 resident can have more than 1 pressure ulcer. Yes.
2.
Yeah.
Or more.
Yeah. Good.
Thank you.
Sure.
See what I don't know about that?
Yeah.
How can you speak to staffing? And I know that there have been some CNA classes. Do you want to speak to that? And
Yes.
To, any of the recruiting that's going on?
We've done really well with our recruiting. We actually have over 100 CNA applications, CNA training applications. So people are really getting the word out through Facebook as well as other methods of communication, and we are doing well with that. Our next challenge, of course, is RNs and LPNs, which we are working on as well.
And is there any update on the tuition program or any other outreach that you've done?
Yes, actually, tomorrow we start the communication process to get more people involved with tuition assessment. I've been walking around the facility as well as Jennifer, and there is a lot of interest from staff about getting into the tuition reimbursement program.
Question?
Sure, go ahead.
The outreach for that? Is there an outreach program?
Oh, yes, it's through, I think it's the Northampton Community College, NAC. I always get that screwed up, I'm sorry, NAC. Yes, they're working with them as well on that to go ahead and get more people interested in the program. So
is that the only college that they're going to pull from? Or?
Initially.
Okay.
Initially. Then there will be other colleges in the future, because I know some people are already connected with other colleges, and they say, oh, this is not going to include me, but it could in the future. We just want to see how NAC does first.
And is CIT, CTI? Do they have a nursing program or nursing? Do they?
Yeah, CIT, yes.
That's the local tech school? They do?
Yep.
Yeah.
And what level? Is that an LPN?
Well, it's a high
Or is it
school.
pre-nursing?
It's a high school level.
Usually it's probably an LPN program to start, and then they can go advance into the RN, to the nursing schools.
Okay.
Question.
Go ahead, Nick.
Can you give us an update on the bed situation, use and/or training to use them?
Yeah, we did have the vendor look at all of the beds to make sure that everything was okay, and also to retrain with regards to the pressure. And as you can see by the reduction in the pressure ulcers, things are definitely improving.
Okay. Thank you.
Sure. Any other questions for me? Yes.
On our agenda, there's a request for an additional position. The specifics of it weren't really addressed last night. Could you maybe tell us what that is and why you believe it's necessary?
Yes, that is a risk manager position. We do have one staff member who does it, but for a facility that size, it's almost unheard of. In other facilities I've worked in, we've had risk managers for maybe 120 beds, one person. But as of, yes.
Excuse me, I'm sorry. I think we're talking about the,
Informatics?
No.
Training?
it's the,
Clerical tech, 3,
part-time to full-time training person. You might not be in the loop.
I'm sorry, I'm not in the loop on that.
CS 15,
Wrong
clerical
loop.
tech 3.
I didn't get too much into the loop. Chris was covering.
Sorry about that.
She did. It's pretty lengthy. I have a pretty lengthy email here.
Can,
Yeah, just to give you an explanation, the request is actually to make a part-time clerical tech 3, who's currently working 16 hours a week now, to a full-time employee who works 40 hours a week. Her position is the assistant to the staff development coordinator, who is the nurse on staff that's in charge of keeping abreast of all of the government regulations that require training for nursing home staff. And that would include not just nurses, but also CNAs and any other staff, including even dietary aides. As I mentioned last night, that they have a software and a system that they're using, but it's overloaded and it frequently crashes, so it is no longer working for them. Last year, I guess a decision was made to upgrade to a new system. They have that. We're implementing that now. And this clerical tech is instrumental in doing that. But eventually, she'll be responsible for helping Nurse Schneider with making sure that they get the right training up into the system so that the employees can access it through this system, take the training, and then the system can capture who's received the training and who hasn't. So it's important that we have someone pretty much dedicated to this job. It's a big facility, it has roughly 700 employees. I know there was a question yesterday. If I didn't fully answer it, would you like me to try again?
Well, no, I guess, I mean, the problem I have now is the fact that some of the folks at the nursing home are out of the loop on it. So I think that's a concern for me. And again, I think my problem with it is that I believe that this is something that should be done as part of the county HR function. Like, you know, in my school district, we don't have a separate training, somebody that keeps track of training for the bus drivers and for the maintenance workers. It's the certifications that they need. They don't have their own individual person. That is captured in the human resources department,
well,
rather than within each.
Yeah, and I think
so
in this,
that doesn't make sense to me that we're having an additional person.
oh, certainly, of course, Ms.
But also, like, I think this is more parallel to a hospital-style rating than a school-style rating. And in hospitals, you have an HR department that hold all those certifications, but usually the managers in each respective department make sure that all the educational standards are up to date. Because I think you're talking about a lot more than just this one thing. I mean, I'm sure the state has standards and benchmarks that you have to upgrade every year, correct?
Yes, and someone to keep aware of it. And that's what
infection control.
That's what the nurse,
and,
Ms. Schneider, does. She's really the nurse that's in charge of that. She has the brain to handle that. Traditionally, there's only been 2 clerical HR people at Gracedale.
Because those are the things that you will get dings on the state evaluation if they're not kept up. And so it's good probably to have an extra pair of eyes on that to make sure that things like that aren't slipping through the cracks.
That's exactly right. And if I could tell you, I have experience in the school setting as well. I served as an attorney advisor to Allentown School District's Human Resources Office for over 6 years. It's a big school district. They actually did have someone who was in charge of professional development for teachers, aides, and other people because there's a lot of training and development that is required of schools and a lot that is just valuable to have when you have large, diverse school populations. But even so, the state kept track of a lot of the teachers' training. I know that. So they had a little bit more of a leg up than we really do. But what this clerical tech would be doing, possibly, I can't disagree that it could be done in human resources. If the training were done out of the human resources office, we'd have to almost somehow find a way to grab that nurse, Ms. Schneider, and put her into human resources, I think, to really make the thing work. Because like Ms. Vargo-Hefner said, you need to have someone that has the training and education to understand what nurses need and what's needed in the nursing home setting. We don't have those people over in the Gracedale HR because it's never been, historically at Gracedale, they handled a lot of things that you might consider to be HR functions out of the nursing staff.
You're a blue ribbon school, that's why you don't need it, John.
I'm sorry if that's not very satisfying.
You know, again, I just think it goes back to this larger question: is Gracedale its own separate entity, or is it integrated into the county? And at some point where they want this independence, and some point where they, want dependence, and to me, the HR function, either it's here or it's there. I think we've got feet on both places.
You're right.
Ms. Hefner, if I may, I just want to point out that I know for years we had a HR individual, and I don't know what happened after I left, but in human services, and the main thing was because of hiring in human services, you jump through all these hoops, whether it's civil service, career service, funding, reimbursements at different levels, as even the new folks have already seen, 100%, 90%, 80%, no percent. And frankly, I know at the time, human resources appreciated it, that we had a person that we could go through that, even though we were all in the same building at that time at least, because they were on top of that, and they knew what was going on all the time. And at Gracedale, it was pretty much the same thing for years. They've had their people. Now, I would say the only concern I would have is if there's a breakdown in communication. And that's the key, is communication. But as far as who has them or where they sit, I think it really probably evolved out of an efficiency issue, but that would be my take on it.
Thank you. You're right. I know that Human Services does still have that person. Her name is Georgine, and she's the assistant to Ms. Wondolowski. She does a few other things, too. Good multitasker.
I have one more question for Mr. Soto, but thank you.
Thank you.
Do you have any more for Ms. Kelly? I have a question on the, we talked a little bit before about the need for antipsychotics and the behavioral health issues. How is that coming along? Because it looks like your numbers have been dropping closer to the benchmark that you've set. So,
yeah, actually, we just had a meeting, kind of like a re-kickoff meeting with MedOptions, because what had happened is when MedOptions came in, they really were there to help us get over the hump of the assessments that had not been done by the previous psychiatrists who left prior to the date that they were supposed to. So now that they've played catch-up, now they're reintroducing themselves to the nurses because they want to make sure that they understand all of the services and products that they provide. One such being, we had today all of the psychologists involved, neuropsychologists, who basically gave a synopsis of different cases and how they handled situations and how they would look to the nursing team to work with them on that. So that was actually really positive. And that was with the administrative staff, but next they'll have it just with the nurses, because they want to know that, oh, if you have an issue, we don't just want to look at psychotropic medication or med management reduction, we want to look at behavioral therapy as well, or maybe instead of, where we don't have to. I can give you an example. She was talking yesterday about one resident who she came into, not at Gracedale, someone else, but she said that the resident said she kept seeing her name in wallpaper, and her name is Joy. And they were ready to put on, on psychotropics because they thought she was hallucinating and everything. But when they looked at the wallpaper, the way the squiggles, you could see Joy, the name Joy in it. So it's just a matter of digging a little bit deeper and not resorting to medications at the on-front. Yes.
and they're infused all throughout the population, correct? They're not like, the behavioral health clients aren't necessarily contained to one floor or another. They're all
they're throughout
the population.
The building, yeah.
Anybody else have any questions? Okay, thank you very much.
Thank you.
Ms. Wondolowski is going to present to us because Tiffany could not be here. I believe she has a family obligation tonight.
She does, but I have a follow-up about Gracedale. Our DON started last week, and to quote her, had some extreme personal issues come up totally unexpectedly, and she quit immediately as of yesterday. So that was unexpected and a huge disappointment. I think it was her 7th day on the job. So we are restarting that search. No. We had, in addition to Inga, we had one other qualified candidate. And, thank you, Liz. She
I'm going to get you those stools.
Opted. I'm wearing big heels, too. Sorry. She opted to decline the interview because she comes from New York City, and it really was the on paper the most qualified, followed by Inga, and her current salary was $150,000. And she said,
okay.
no, thank you. So.
Yeah. And even though $150,000 might be not what's comparable for directors of nursing in our area, we understand there's a premium for New York City. What we were prepared to offer, we feel really did hurt us in the recruitment effort. The way under the career service salary scale, the starting salary for the director of nursing is $74,700. We were able to go up to approximately $85,000 without seeking council approval, and we really only got 3 applicants. We feel we would have done much better if we could go up to between 90 and 105,000, which is about the right range for the job. So we may be coming to you, and I just wanted to mention that now, since I seem to be the deliverer. Sorry, of bad news.
Little aside. Just,
Yeah, little aside.
So you're saying it's not
something to think about.
Excuse me, can I ask you, what's the level at this point where you'd have to come to council? Is it like a C grade you can go up to, ABC, or?
Well, that's correct.
Do you even do that anymore?
Well, I think they do call it like grade 33, step 1A, 2B, 3C. We'd have to go up to 4D, which would be anything above 85,000. I think.
What's the top end on that
top
scale?
end is approximately 115, I think.
All
I
right.
have to double check because
I mean,
don't often work with the top end.
Yeah.
In my line of work here.
I just want to pass on some of these jobs, and I know it's difficult, and it's throughout the county. There are certain specific kind of jobs where you're going to have a tough time recruiting. If you need to talk to us at any time about an issue like that, I'd like to hear about it, because if council wants to see something happen, we have to be willing to take the initiative to make it happen. So I was just curious where it was now that you could go up to. I know that's always been in place, but I didn't know where you were now.
We would need to come to you and ask for permission to go up to a D4, which would be above 85.
Are there any other incentives that you could offer a person in that position that would offset the pay?
I think so, but we need to get the pay up to a place where it's at least comparable. We wouldn't be, even at, say, going to 100, we wouldn't be higher than everybody else.
What's
We'd
a comparable
be
salary
comparable.
as a dealing?
Well, based on what I've seen from this area, about 95 to 100 is the range, yeah.
for that size facility.
But, well, and they're not necessarily that size facilities. I'm going by director of nursing, not a small facility, probably a larger, but we're bigger than most. So
middle.
If you want to take that into consideration, I think that would move the 95 closer to 100.
Yeah, I would
But definitely we have perks. I mean,
What kind of perks?
Well, I think it's nice to work in a nursing home setting. It's nice to work in a public sector setting where we have, nice schedules for nurses. I mean, when we don't have low staffing and have to mandate people, they can work a 40-hour-a-week job. I don't think you find that at hospitals around here, especially in nursing. I think that I've been told by the nurses at Gracedale that you can get a much broader range of experience as a nurse in a nursing home setting than you will in the hospitals, because the hospitals tend to be very specialized. And I do know of at least one friend that I have who is she calls it being a port nurse. All she does all day long is put in medication ports in patients at Lehigh Valley Hospital in Muhlenberg.
Mm-hmm. Okay.
Did you ask her?
Well, I would just note that the previous director of nursing, the council did approve a higher salary when she came in. I think it was in July. So just for reference, if Linda, if you could look up what that number was, and that might give us an idea as to what we had approved in the past, and I wouldn't have a problem. I supported it then, and I would probably support it again.
Thank you.
If I may.
Thank you.
If I may, the question I would add to that is that I know there may not have been a lot of time for an exit interview on what took place, but I would be more curious to know. The money is not so much of a question as what's been happening. Why would someone quit so quickly, and do we want that to happen again when we do our vetting purposes?
Well, so ideally, we would not have someone quit in the second week.
Without notice.
Without notice. I was notified via email and responded via email, and I have not heard back, and based on the circumstances, chose not to reach out by telephone at this point. I did not get details of what the extreme personal situation was.
And I don't think you should.
No, it's not now.
Any further.
No.
If council wants to have an executive session later, we can do that and share the emails with them. But
Thank you.
Don't say anything else.
Thank you. I wasn't going to add any more detail, but thank you. I don't have anything to add to that.
Bill, you had a question?
So no, to answer your question,
Yeah.
I think this was
My question wasn't to probe. My question was that we didn't have time for the exit interview, and there must be, we don't want that to happen again, and leave it at that.
Got it.
I don't think it was that issue, but go ahead.
Yeah, I just want to, you don't have to answer this now, and it's nothing about that other person.
Sure.
But what's the history like of the director of nursing? Has it been a long tenure in the previous directors of nursing, or not, or has it been choppy, or?
I don't have the history on that. I don't know if.
Jen's shaking her head. Do you want her to come?
Do you want to? Yeah, if Jen can answer.
Okay.
The lifetime archivist of Gracedale.
Hi, I'm
Hi.
Jennifer. So Marge Voigt was here for many years. She left when Dee Freeman was administrator, so that was within 5 years. Beth Berklight, who was a charge nurse on Tower
Beth.
8,
Okay.
took the position,
Okay.
and then she was able to retire, so she just retired in the summer. So it's just in the last.
And the position wasn't filled from the summer till now?
Yes, it was.
No.
Yes.
It was?
Yes.
Because they approved a new salary in July, they just said.
Janet, what?
Right.
Harrison?
Janet Harrison then came on after Beth Berklight.
So just recently, it's not been
Correct.
a long tenure, so, I certainly think that the person in charge of everybody should be compensated well, because, the responsibilities, you want them to have skin in the game. If they don't, and they don't really care, and they're not getting paid well, then, so, okay.
I have a question, Madam Chairwoman.
To whom? Just
To
Okay.
Sue, it's fine. I'm just saying, I think for going forward, and also, I guess this is just in general, Human Services has some, Gracedale and the other areas, some specific skill jobs. Noting now how things have changed with the quick access to New York, Northern New Jersey market, I think we're competing a great deal more now with that market in terms of employment than when we ever did in the past. And the thing is, I think we're going to have to just be looking at that going forward, with other areas of the county too, probably. I mean, that doesn't mean, we can go out and everybody gets the end of the scale. But I'm just saying, I have a feeling that this is something that probably is a little different than in the past. I know even in the past, casework in different positions, we bring them in, and it would be kind of low then. I have no idea what it's like now in the private
it's still
market.
low, and
But it's just an observation.
There's only so much we're going to be able to do
Yeah,
to
yeah.
rectify that. I know that, but there are certainly some niche positions like the DON that.
Well, I would get the sense Liz has probably seen this and others, that we're competing more with a new
Yes.
market. And
Yeah,
to
probably
compete with
that's
that
true,
market
yes.
is going to be really tough.
Sure. Agreed. And I mean, Gracedale is the largest nursing home in PA under one roof, so that's a very, so I was told. I was told that.
No, I was
By
Clarify.
somebody at Gracedale. So that's a factor. And it's we were discussing how it's a unusual layout with your tower and the main building, and there are some inherent challenges that, folks work hard on a daily basis to make it a great place, and we need a DON we need to be able to attract 3 qualified candidates to choose from, and who will work for the salary. So that's update number 1 on Gracedale. And in lieu of the brag book, Mr. Soto had sent me, because I told him he always forgets it here, so he couldn't bring it anymore. So he sent me some emails, though, that he received in relation to patient care. So Mr. McClure asked me to read one of them, and I will do that. So the first one is, Dear Mr. Soto, about a month ago, my mother, Kathleen, was admitted to Gracedale as a rehab patient. Since being admitted, we have submitted an application for her to become a full-time resident. I want to let you know what a positive experience she is having at Gracedale. In the short time she has been with you, she has had superior care. Her diabetes is under control to the point that one of her many medications is no longer necessary. She has lost weight, is receiving excellent physical therapy, and has been cured of a persistent infection that her previous physicians had not been able to tackle. Her charge nurses, Becky and Howard, have made a tremendous effort to get to know her and understand her medical issues. They communicate thoroughly and efficiently. It is clear that they know their jobs well and excel at what they do. The nurse aides are kind, compassionate, and responsive to mom's needs. I am still getting to know their names, but Christine and Rob in particular have made such an impression on us. It is such a comfort to know that my mother is safe, respected, and well cared for. During these last 3 weeks or so, I have felt the burden of constant worry lifted off of my shoulders by the wonderful people who work on her unit. I don't worry about her falling, what she is eating, or if she is lonely. When I visit, I not only look forward to seeing her, but all the dedicated people who contribute to her care. Thank you so much for taking the time to read this. The work of your staff has been a blessing to my mother and our entire family. So,
Nice.
I have another one, but I won't read that whole thing. So, anyway, it's we get to hear a lot of complaints sometimes, so it's nice to hear the good stories. Any questions remaining about Gracedale? Okay. So I was going to just give a short update since Tiffany was unable to be here, and then I can, if you all don't mind, I can just give you the rest of the updates as well for Human Services. Rally for the Valley, which I've mentioned I think the last 2 times, is this Saturday, the 19th at Cedar Crest. I understand it is supposed to rain, but I also
Is there a rain date?
No, they have a very large tent. The party will go on, rain or shine, as far as I know.
A tenter.
A tenter.
Yeah. That's pretty funny.
I saw that billboard. So that's Saturday.
What time?
That's a good question.
Okay.
I will get you that before I walk out of here.
Is that at Cedar Beach?
No,
Cedar Crest College.
Oh, Cedar Crest College, sorry.
Yes, I will get the time for you before I leave. Tiffany is actively working on compiling the block grant as we speak. It's due at the end of the month. Every division administrator submits their portion to her, and she compiles it. And apparently, there's always 1 or 2 late offenders. So last month, I said anybody who was late gets to write it next year. So we had 1 late person, and he is writing it next year. So that's how we're doing that. But anyway, with help, don't worry, it will be done on time. But that will be submitted at the end of this month for next fiscal year. It's also contract season, so we're finishing up contract amendments in drug and alcohol and everywhere else, and going through and reviewing contracts for the next fiscal year. And with drug and alcohol in particular, we have a few new RFPs that we are exploring and have some follow-up questions, but hopefully in the next month or 2 we'll have more to share with you related to that. The Rally for the Valley is 11 a.m. to 4 p.m. Thank you, Liz. Any questions? Okay. One thing I forgot about Gracedale, and then I'll move on, related to the CNA training. So we went from those classes being like around 8 or 9 folks, and we can have a max of 14 or 15. So as Ray said, 100 applications we received in the last few weeks. So we're looking to get permission from the Department of Ed to add a second class and have it during second shift, since that second shift is the hardest one we have to fill. We're hoping that if we offer a class at that time, that those would be the folks who would be interested in working that shift anyway. So more to come on that, but I wanted to let people know that. We still don't have an MHMR administrator, and civil service is making me crazy. I know you know. So civil service, I might have mentioned this at another meeting, civil service shut down for about 2 months and just I'll call it reopened, because they were revamping their system. They went to NeoGov, which in theory in the long term will be better for us. In the short term, we have, I think Kevin Dolan told me, 26 or 28 vacancies that we are having children and youth that we couldn't even pull lists for. And it's a significant issue, to say the least. I think we successfully posted our first position the other day, and even more ridiculous is that if you took the test prior to the system being updated, too bad, you have to retake it. So,
Can I ask a question on there, Madam Chairwoman? Just in line with this, is this just for their service at the state, or I know they're reviewing the actual pay scale for children and youth civil service, but is that a separate issue? So that hasn't been done yet. All right, so this is just informational system type things.
yeah, this is just civil service as a whole,
Right.
any position.
Okay.
As you all know, children and youth is always the most largely impacted. And the other barrier with children and youth, and not just that, but human services, is this right to return. So when folks take new jobs or are promoted, which that's what happens from children and youth, you go upstairs. That's what I always joke. People upstairs complain, oh, so-and-so at children and youth is doing this, and I say, that's where you came from. Don't talk to me. You left there for a reason. It's hard work. So, but they have this 3-month right to return. So some of these vacancies are simply because we're not even allowed to fill them until the person says, okay, I'm really not going to go back to my job.
Oh, wow.
Yeah. It's not just that people quit.
Do we know that?
Oh, it's that they move around, too.
Oh, they do. Yes. And sometimes they move around within children and youth, but oftentimes
Is that through the
they-
whole county? Is that the whole
Part of the
county, or
union,
just
is that part of
human
the, it's part of the
services?
union contract, isn't it?
I think it's civil service, but don't quote me.
It's
Both?
I thought
That's a
that.
personnel
funding.
issue, I guess we could ask later.
Federal funding, Liz says it's a.
No.
Yeah, I believe that's part of county regs, as far as, I mean,
It says it's a federal.
yeah, you have to let people.
The federal money that passes through the state and comes to the Department of Human Services requires us to have a merit selection system, and the state civil service system has been determined to be such a merit selection system.
Back when I was in that position, Lord knows I tried many times to blunt that, much to the chagrin of many employees, and it was usually unsuccessful because I get hit with 3, union grievances, and the county HR would scream at me. But
Well,
I mean,
and another issue related to that is, we pull a list from civil service, which we're required to do. So if we have a caseworker position that's vacant, we pull a list, they send you the top 3 names. The problem is, until they're hired or opt out of being on the top 3, we could interview them and think they're totally unqualified and not want to hire them, but we can't move on. You guys know all that. It's frustrating, which that's what it is, that's what we deal with, but it's a barrier. So that's why I mention it, because it's a barrier. So I'm still waiting, I got diverted, MHMR. All I'm waiting is for them to tell me if one person is qualified. It shouldn't take this long, but it is. So I've sort of mentally moved on. I have not really, but I've considered other applicants and are just waiting to move forward if I have to, if that person is not approved. So
Got it.
maybe next month I'll have a answer. Some really great news. The Area Agency on Aging, we had a visit with the state it was this week? I think it was early this week, or last week, and they came back to do a re-review after the failing grade and being in the red, and the woman who came back had very high praises for the folks in aging, and she told us we went from a very low red to a medium yellow, and she really was, so I realized yellows, we want to be green. Did you say something? Soon, yes. But the state did not expect us to have made that much progress in that amount of time. And so they were very complimentary of all of the different things that have occurred. So we are medium yellow, and they will be back in 6 months. And we
screaming green.
Plan to be green.
if you mix yellow and blue colors, you get green.
You do. Okay, what about yellow and red, orange?
Yeah. What do you need to do to be green? Like, what did they say?
The good news is that the bulk of what we need to do, we can address through their monitoring sheet. So they come out with a 2-page survey of, do you have this, and this
Yeah,
in the
it's like a
files?
checklist.
So there was a few repetitive issues that we didn't have that maybe we didn't ever know we needed to have from previous time periods. And so some of those are very easily corrected, and some of the other things are a retraining of our intake staff, which is in our information and referral services unit, not our aging unit. And so the state is going to come back and do that with them too. But even though there was still some deficiencies, there were none that put anybody's safety in jeopardy. It's really the paper trail, and we have to rectify it, and we will.
So is there any cost associated with trying to make these changes?
The only cost associated is that we are one of the only, I'm not going to say the only, but one of the only counties in the state that does not have a separate supervisor for protective services. This would have been a later conversation, but you asked. So
I'll just get right to it.
I appreciate that. I'm a straight shooter. So that is a conversation I will be having in the future. I think it's very attainable, and given the second topic related to aging, also affordable. And the second topic related to aging, for those of you who do not know, is John Mailer is retiring on June 7th. So he will be here for his 43rd year. Will be in June. I'm not sure if it's right before he leaves or after 43. Yes.
That's my whole entire life.
Be sure you tell John that when you see him.
I'm sure that'll make him feel really good.
It's actually even more than my entire life.
Hadn't thought about that. You're totally right. I'm right there with you.
Lori, I have a question.
Go ahead.
I understand now we do assessments in
Yes.
aging.
Yes.
How is that, I know, with your staffing and whatnot, that taking on that responsibility?
Well, I will say successfully navigated our first grievance meeting a couple weeks ago, and the interesting thing is that I assume it's related to demographics, as the aging population grows, the over 60 population, the referrals in the last year have really increased. I'll get the numbers at some point. It's certainly not like children and youth, but it's a significant increase. And even our information and referral services administrator said they started taking these protective services calls for us so that our protective services workers could focus on what they needed to focus on, and he said it's at least double the volume that he had expected, and it's only been a month.
Well, I'm just, because I think, and we'll probably see this across the state, our distinguished CCAP president is here tonight, great. But the thing is, it's something that we didn't take as seriously in the past years as we're going to have to. I mean, the aging, the boomers, the gray hair and the blue hair, I mean, it's just coming on. It's a storm. And our aging,
It's a storm. A different kind of blue
and the no hair. Well, you know, most of the well, that happens early. As you know, The Rock has no hair, and he looks like a young guy. But anyway, no, I mean, it's a problem, and I think every county is probably either experiencing or will experience. And I know that aging doesn't have the strongest funding source out of Harrisburg, but I don't know. I mean, I think we're going to have to look at some action plans on addressing it, because we are a very populous area. And I'm just saying, it's something that
So it has to be factored in, and we have to consider.
in years past I begged we would prepare for, but there were more important things on the agendas. But I think it's something we do have to look at as a county.
No, I agree, and I'm told that unlike some of the other divisions, whatever money we get from the state and feds in aging is what we get. It's if we want to add a position, if that's what you have in your pot of money, that's you add it.
And that's what we may have to confront in the near future.
But with Mr. Mailer's retirement, having been here for almost 43 years, we will be able to afford a protective services supervisor if we're actually just looking to get that in writing from the state as a recommendation.
So when he retires, you won't refill his
We
position?
will, but he's been here for so long,
He has
no
so
one
much-
will make that.
No one will make that
salary.
Okay, yeah,
Yes.
yeah. Okay,
Yep.
I gotcha.
Yep.
Wow.
Yeah. So.
Is there any update on children and youth in terms of just the paperwork and the issues or
Nothing.
with the
No,
state?
I don't know if you guys saw the Auditor General's report just came out, and I did not have time to read it in entirety yet. I skimmed some of the recommendations. I'm not really sure what, if anything, will actually change or come about from that, but paperwork's still the number one time-consuming thing. It's trying to be nice.
So
I saw that.
I can't think of anything else.
Okay.
Can you think of anything else? Any other department?
Yes, I have a list.
Go ahead.
I'm almost done.
No, it's your time.
Almost
Go
done.
ahead.
Glazed over, I know. Children and youth, almost have, our managing attorney resigned last month in April, and we have an acting managing attorney. We have posted for the managing attorney. That will be filled in the next 2 weeks. And in the meantime, even before that departure, we were in need of an additional full-time attorney. And the budget, Kevin's budget, has allowed for, with these Act 148 dollars, to do that as a contract, so almost having somebody like a vendor. So we did finally find somebody full-time, and she is supposed to start mid-June. And then we will still be posting for another full-time attorney. And Kevin Dolan does what he does best, and managed to, of the 11 new positions that he got approved by the state for starting July 1, they agreed verbally, we're waiting for it in writing, to convert one of those caseworker positions to an attorney position. So we will be able to not even have to use Act 148 dollars. It'll still be that 80, 90, 2010, whichever funding. I'm not sure which one it is. So that's a significant need. And because of the staffing, they are working on a contingency plan, working off of their contingency plan for general and protective services and child protective services. There's a maximum caseload those folks are allowed to carry, which they are at, except we still have to answer the phone. So I don't know the details of their contingency plan. Supervisors end up taking cases. It just is a sort of a trickle-down effect. So we're really working on trying to rectify that.
May I ask a question? We've never had a real problem with positions available for CYF. It's been filling them. And I assume that's still happening, finding people to fill these positions in children and youth.
Well, and civil service closing for 2 months doesn't help us.
Yeah, I mean, that was
Yeah.
an added bonus.
The biggest barrier we have, to be honest, is that I see as civil service and that rule of 3, and really kind of being stuck and knowing you really don't want to hire 1, 2, or 3 for very valid reasons, but you really can't move on unless you do. It's just very cumbersome,
Yeah.
and it is absolutely a challenge. But we're definitely in a place at the moment, so we'll leave it at that.
Okay.
And the last thing is I mentioned the Stepping Up initiative in the past, and the CJAB, the Criminal Justice Advisory Board, it consists of folks from our Drug and Alcohol Unit, Mental Health, myself, Judge Daly just subbed in for, I wasn't a part of it, I forget which judge was on it before, criminal justice folks, people from the prison. So it's to reduce folks with mental illness in the prison system. So there's a grant proposal put out, but we would have had about 2 weeks to put it together, and we would not have had time. So, but part of it was a detailed sort of instruction manual, if you will, which this group is working on and will use as a model to be able to apply for this grant for next year. And I think it's essentially a 2-year funded grant, and then we'll see how it goes and go from there. So, any other questions?
You had mentioned before about reducing trauma in the families and things. And you talked about a crisis family engagement initiative. How's that going?
Kevin, I think Kevin is the one who spoke about that. Yeah. That's the one where Northampton is one of 7 pilot counties in the state. They had a meeting in Hershey or Harrisburg, I think, in the last couple weeks, and the woman from the state told us that Northampton County is absolutely leading the way in that effort, and we're pretty far above. I think what she said was when she came back after the first, after a few months, everybody else was here and we were here, and now it's sort of like we've really further separated ourselves from the pack. And Kevin has stats on how many kids we've actually been able to keep in the family setting and avoid court altogether. I want to say it's 20-something, but it's clearly working.
Okay,
To
that's
avoid
good to know.
placements.
That would sound like a nice concept to keep the kids in with the family members,
Awesome.
so.
Yep.
Okay, thank you.
Yep.
Any other questions or any other? What day is it for you? Is it months now?
Almost Friday. Oh,
Almost.
see, it's almost. That's all.
No,
now
remember
I'm
how
on,
you
it's
used to
almost
come,
Friday.
I was teasing at Gracedale, it's
I'm
day
in my-
5.
I'm in my 4th month. Yes.
4th month,
Yeah.
see?
Time
Kudos
flies.
to you for not fleeing with all this going on.
No, I love it.
Thank you.
Thank you.
Thanks for what you do. I
Yeah,
appreciate
need to be
it.
evaluated. I don't know. I do. I love it.
Adjourn?
Let's go.
Adjourn.